So during the first few years of life, an infant swallows using most of its soft tissues. The teeth are not erupted and the alveolar tissues have not yet developed to support or balance the tip of the tongue during swallowing. The soft tissues which get involved in the act of swallowing are the tongue, the lips, and the gum pads, which later develop into alveolar processes after the eruption of teeth. This characteristic type of swallowing is known as infantile swallowing or visceral swallowing. The tongue is positioned such that it gets inserted into, or sometimes it protrudes between the gum pads and the lips. And together, these three things, the tongue, the gum pads, and the lips, form the anterior seal. This anterior seal helps to push the contents of the mouth behind during the act of swallowing. The infantile swallowing is characterized by the jaws or the gum pads being apart at a distance from each other so that the tongue and the lips accommodate the space in between and create an anterior lip seal. The tongue is positioned low in the mouth and away from the palate to create the space which can be accommodated by the feeding assembly, which can be nipple. The orofacial muscles, particularly the lips, play an important role in infantile swallowing by stabilizing the mandible in coordination with the internal force of the contraction of the tongue, as well as it takes part in formation of the anterior lip seal with the tongue and pushes the contents of the mouth back towards the oropharynx during the act of swallowing.